take a quick look at Chapter 10, Diseases of the Respiratory System. Just a couple guidelines here. We're looking at the J codes, J00 to J99. So we still have our guidelines for acute respiratory failure in terms of sequencing. So this is the J96 category. There's a couple paragraphs worth of guidelines, but really it just comes down to looking at your definition of your principal diagnosis. Why is the patient there? So it can be a principal diagnosis, it could be a secondary diagnosis, and then of course you need to make sure that you follow other sequencing rules, such as those with HIV, which we've looked at. We haven't talked about obstetrics or poisonings or newborns yet, but we need to make sure that we follow all of those as well, and we'll get there here in a little bit. And then really the only other guideline in here is concerning influenza. So it's just stating that for we've had a lot of these like bird flu and swine flu and those kinds of things in the last few years. We can only code confirmed cases of those. So this is kind of one of those exceptions to that rule for inpatient, where you can code like suspected, those kinds of things. With an H1N1, swine flu, avian flu, any of those, you can only code confirmed cases. Now that doesn't mean that they have to have positive laboratory testing back, but the physician has to basically state that it is swine flu or something like that versus a suspected or possible or probable one of those. So we're in that J09 category, .x, and I think this might look different than some of the slides that you guys have. It's just influenza due to a novel influenza A virus, and then our subdivisions down here indicate exactly which one, swine flu or which virus it is. If the physician does document something like suspected or possible, then basically we just code it as influenza due to other virus, just because we haven't confirmed that it is one of these novel influenza A virus. Alright, here's our practice. Acute respiratory failure in patient admitted with pneumonia. So let's take a look at coding this, and then we'll talk about the sequencing here. So, sorry, I should have started. Well, since I'm here, let's go ahead and code the pneumonia, and then we'll look at coding the respiratory failure. So here's pneumonia, and then in this, we don't really have anything else, so we can go ahead and just grab our J18.9 code. And then let's take a look at the respiratory failure. So I'm going to go up to F. And failure actually is pretty close to the top. So here's failure. I'm going to go down to respiratory, which I'm on page 531. Here's respiratory, and then here's acute, and we get this J96.00. So we got both codes there. Now in this case, there really isn't enough information to really know the circumstances of admission. We don't know if the patient was admitted, if the pneumonia is kind of the main thing, but they happen to be in respiratory failure, if they're really coming in to treat the respiratory failure. We don't really know. But it would make sense, if we're not really sure, to code the underlying condition or the pneumonia first, and then code the manifestation or the respiratory failure second.